Well, the Good Samaritan found the person who had been robbed along the road. He was bleeding and very ill, and the Good Samaritan brought him to an inn. And he said to the people at the inn, bathe him, cleaned his wounds, take care of him until I come back. And when I come back from my trip, I will pay whatever it costs you. You help people who need a little extra help. And not a little extra help at times, but a lot of help. So the Good Samaritan Fund reaches out to people who have met with hard times. Just like the Good Samaritan on the road, he was robbed and beat up. He fell on hard times.
From all the Bethany communities, the Chestnut Square in Glen, or the Partners in Healthcare, the Good Samaritans has always helped us in these kind of situations, and those funds have been a tremendous support for us so that we can help. Sometimes many of the residents are running short in funds to be able to get the medications that they're looking for, and we've been able to help them through the Good Samaritan funds.
I have seen 3 different employees be touched by the Samaritan Fund, things that they could have never handled on their own, things that we could have lost them as co-workers if we didn't have that fund. If you walk away from the day and you say you've helped somebody, that's what it's all about.
There's a lot of challenges in healthcare with regards to treating patients and transitioning patients from hospital setting into another setting. And oftentimes we find needs for the Good Samaritan funding to assist us in these endeavors. It costs $500 or $600 for a patient to be transitioned from a hospital to home. Many insurance companies, including Medicare, does not pay for those services any longer. Oftentimes, we have individuals that are indigent, who are in need of clothing, shelter. We assist those individuals through our Good Samaritan Fund. It makes me feel like I'm a part of an organization that cares. The organization makes a difference in the lives of all of those whom come in contact with it.
I think the population that we work with, largely the psychiatric, the behavioral health patients, are a population that don't get a lot of attention. And it's a population that really requires a lot of attention. You have small gains working with this population because there's so much that they're dealing with and so much they're fighting against. And they come into the hospital and get stabilized, and then they go back out into the community and they really need support and don't always have it. Having the resources to do that, I mean, that makes all the difference.
We are all part of the community. The community here includes the residents, the staff, the family members, the volunteers, all who walk through the doors of the Bethany Family Organization become a part of this community in some ways. And so we're all healed and made more whole together. And we do believe that with God's help and with the help of our supporters and the support of the Good Samaritan program, we will be able to do that.
And that's the beauty of the Samaritan story, is that the Good Samaritan left that poor man with caring people at the inn. And I've seen them treat people who have no funds, people off the street. I've seen this over the years. And that's how Bethany is. Maybe we should call it Bethany Inn. An inn is a beautiful place where you feel at home. You're not in a hotel room. You're in a home, someone's home. So I just thought of that. It should be called Bethany Inn.